Ready? Hi there, Marvin Music here with MedicareSchool.com, and we want to welcome you to our live event tonight. We're going to be answering some questions that you have, and then also covering, I hope to be a topic that will be helpful for you. We're glad you've made this a part of your evening to be with us. Just a couple things. We would love to know where you're viewing in from, where you're coming in from, so if you would mind putting that in the chat. Your location, your city, your state, and then if you happen to be our client, you could mention that as well. We'd like to know those of you that we've already had the opportunity to be able to help. We're glad you've been a part as well. Tonight, we are going to take questions, so if you'd like to start typing those questions in right now, I'm going to cover our topic for maybe 5 to 7 minutes pretty briefly, and then we'll start getting into those questions. All right, so let's get started. Tonight's issue is dealing with 10 Medicare benefits that you don't want to miss out on, things that a lot of people, frankly, are not really aware of. And so all of us know that Medicare has two parts, A and B. A is inpatient, called hospital. B is the medical side, which is outpatient, all doctor services. And Medicare A and B covers the things that you and I would typically expect an insurance to cover, and that would be just normal in-hospital stays, doctor visits, specialist visits, outpatient surgery. If an ambulance is called to take us to the hospital, Medicare is, of course, going to cover that. There's a lot of preventive services, flu shots, those kind of things. And so nothing new. That's exactly what we expect our insurance to cover. But the list of 10 things that we're going to talk about are things that are not quite as common. Now, the first one I'm actually going to kind of lump together, and that has to do with the way Medicare treats their what they call wellness visits. And there's sometimes a confusion on this because sometimes people, as they're leaving work plans, they're accustomed to very thorough wellness exams. Sometimes full blood profiles are done, and a variety of things are done during a physical. But that's not going to happen on Medicare, folks, at all. Medicare is going to cover you well, but when it comes to the kind of wellness checkups, they're minimal. So I want to explain how the system works. First off, there's one that we're eligible for just the first 12 months that we are enrolled into Medicare A and B. We qualify for a visit that they call the Welcome to Medicare visit. It's also called an initial preventive physical examination. And again, this is no cost to you. It's one time, and again, it has to be during those first 12 months because if someone tries to get this visit after the first 12 months, they'll be paying it for themselves because the code actually expires. And so during this first year visit, what's going to happen is that, number one, the doc's going to review your medical history, going to discuss with you where you really stand on your different preventive services, things that you may need immediately or those that you may be able to delay. They're going to take all your height, weight, blood pressure, body mass, those kinds of things. They also can perform a vision test. And then they're going to discuss several things with you about possibly your risk for depression or maybe any other kind of mental health conditions that you would like to discuss. They're also actually going to talk also about the safety of your home to make sure you're not in a situation where you're going to need some help there. And then they provide education, counseling, and other referrals for other healthcare services and needs that you may have. Again, just a kind of a host of things. And then after that 12 months, then what you qualify for, Medicare calls a wellness visit. And again, sometimes people are a little bit disappointed in the way these work. Let me explain. This is now the second year that we're on Medicare. And this is time when you meet with your doctor. They're going to, again, do routine measurements, height, weight, blood pressure. You go through your history to see if there may be something that they need to be addressing. Probably not during that visit, but in some future visit. So that's what it is. And again, it's just once a year that you would have that. So that's number one. Number two, I think it's important for people to know that Medicare would like to detect diseases as early as possible. And so what they do is they have a host of disease screenings. And most of the screenings actually are at no cost to you, and it would be part of a preventive type of a service that Medicare offers. Things such as diabetes, glaucoma, breast cancer, cervical cancer, colon, prostate cancer, heart disease. Those that have a history of smoking, being smokers, they actually once a year can get a lung screening to see if they might have lung cancer, again, depression, other behavioral type issues. So again, be sure to avail yourself of these things to detect these diseases early because then there's a higher likelihood of recovery. And of course, Medicare is motivated because they know that they'd be spending less money if they can detect that early. Also, those that have obesity issues, we all know that when people are overweight, especially obese, it leads to a lot of illnesses, joint issues, bone diseases, those kinds of things. So Medicare is very interested in helping people that would have some body mass index issues. Now, to qualify for these, you actually have to have a body mass index of around 30 or so, and then Medicare will cover some personal counseling situations for you in a primary care doctor's office to help you move in the direction of weight loss. Those of you who are smokers, and this is the fourth one. Medicare knows that those that have issues with smoking habit oftentimes can have other problems, emphysema, COPD, those types of things. So Medicare is motivated to help you if you would like to get some counseling in that regard to be able to stop smoking. And so that would be something. Number 5 would be hearing exams. Now, we know that just kind of traditional hearing exams and hearing aids are not covered by Medicare. But some hearing exams would be covered if people are having some balance issues. Why? Because normally balance issues have to do with the ears, especially the inner ear. And so if a hearing exam is medically necessary because a person has some balance issues, then Medicare is willing to cover the cost of that. So that may be something that would be beneficial for you as well. Hospice care, again, this is something that Medicare will cover. Now, hospice care means that this is someone that's been diagnosed with a terminal illness, 6 months or less to live. At least that's the doctor's opinion. And so whenever someone qualifies for hospice, again, they've had the terminal diagnosis, but also they have agreed that they're no longer going to pursue preventive preventive treatment, meaning if it's a heart issue or cancer or whatever, they just decided, I don't want any more treatment for the disease, so this would be kind of end-of-life type of care, spiritual counseling, pain maintenance, medications, things like that. So Medicare covers hospice very well. Now, when it comes to hospice care, you can get that hospice care in a variety of places. Many people will just get that at home. Sometimes people will go to a hospice facility, sometimes even in an inpatient situation. Now, Medicare will cover a lot of the hospice care going on, but they're not going to cover the room and board typically. They may make an exception if it's short-term, but if it's long-term type of a hospice facility, then you would be covering the room and board, and then the other care that would go along with that, of course, would then be covered by Medicare. And so that's going to be hospice. Number 7, those that would struggle with alcohol, just like those that may struggle with smoking. Alcohol can lead to further diseases and complications and those kinds of things. So Medicare is willing to pay for counseling sessions for those that would like to be able to kick that particular habit and get some help with their alcohol abuse. And then number 8, almost done here, special footwear for diabetes. I thought this was very interesting. We know that oftentimes people that have diabetes, especially when it begins to get serious, they could have neuropathy. And so Medicare knows that if that diabetes and neuropathy is not handled well, then it could very, very easily lead to amputation. And of course, that's a sad situation, but it's also very expensive. And so for those that are diabetics and are having some neuropathy issues, Medicare is willing to actually pay for special designed diabetic footwear to help the circulation so that doesn't end up being an amputation eventually. So diabetic footwear, again, it's specialized. There's custom molded shoes. There's these extra depth shoes that they'll pay for, and they'll also pay for inserts a couple times each year as well. So if that's something someone has, then just know that Medicare is happy to actually help with the cost of that. Number 9 would be wheelchairs and scooters. Now this is somewhat limited. They will cover them, but it has to be a situation where someone, they're almost immobile, meaning they are having a very difficult time walking. And so for Medicare to cover a mobility device, it truly has to be medically necessary, not just for convenience, but we have true debilitating condition that is making it almost impossible to walk. Medicare would cover that. And the way it works is your doctor has to certify that you're unable to walk without difficulty, writes a prescription, and then Medicare would participate in covering the wheelchair or the scooter. And then lastly, and by the way, this was interesting as I did my research, this is a maybe, but I'm going to tell you about it because it can happen, but it's still kind of a maybe, and that is actually a walk-in bathtub. And the reason for this is because there's people that just cannot get into a traditional bathtub. It's difficult and impossible for them to do that. And so the issue here is Medicare may help with the cost of a walk-in tub. Now, it is true that the walk-in tubs are not on the list of durable medical equipment that we know would be covered by Medicare, but at times this could be covered. Again, a doctor would have to attest that you cannot get into a traditional tub, that you need a tub like this, and then Medicare would cover it. Now, here's the catch. They will not cover it up front, and so you would have to go through the expense of that and then submit those receipts along with doctor certification. So please don't say that Marvin said your walk-in tub is going to be covered. There is a possibility that it would be. All right, so what I would do in that situation, I would talk to the company that would provide that to see if they know exactly the proper procedures to get that tub up, and indeed Medicare would cover that. All right, so I know some of those are not the most common, but we just want to make sure that you all understand that there are many things that Medicare will cover than just the normal. And so I hope you'll be able to avail yourself of these types of services. All right, so that's that for this topic. What we're going to do tonight is I'm in the studio tonight with our producer, Daniel, and so he's going to start giving me the questions, and just shoot away here, Daniel, and I'll try to answer as many as I can before I get worn out. Okay, let's start. All right, my Medicare, Karen says, coverage will begin on October 1. Do I need a referral from my primary care to see a specialist, or can I make the appointment myself? Yes, if you decide to stay in the traditional Medicare system, with or without a supplemental plan, you do not have to have a referral to see a specialist. Now, if you chose to be enrolled in an Advantage plan, then sometimes the HMO plans do require that the primary care doc give that referral before you can see a specialist. That, again, would only be in some Advantage plans and some HMO plans. But otherwise, call the doc and make that appointment. All right, I will turn 65 February. Can Medicare start January 1? Tina, the only way that could happen is if your birthday was if your birthday was February 1st. So if you're born February 1st, your Medicare absolutely would start the month prior. But if you're born February 2nd through the 29th, then your Medicare can begin the month of February. So we always begin our Medicare, our birth month, with the one exception. We're born on the first day of the month, then our coverage starts the previous month. All right, is there a Medicare dental plan? And the answer to that is no, there's not. Now, there are some Advantage plans, there are Medicare Advantage plans that will include a dental allowance where you can get some dental coverage within the Advantage plan. Normally those run about, maybe $1,000 to $1,500 of a benefit. The issue with those, you do... Oh, I'm regular Medicare. My bad. And the answer is no. Just know this now. Regular Medicare covers very little dental. It will cover certain things. If someone has, jaw cancer and there's surgery on the jaw, therefore there would have to be some reconstruction of the teeth, Medicare would cover that. If someone's going in for a kidney transplant or a heart valve issue because it's necessary that their oral health is good before going through that surgery, then Medicare would cover that particular visit, maybe any care that would be needed around that. But again, very extreme cases. So as far as just things that you and I would normally think about for dental cleanings and extractions and fillings and root canals and crowns and those kinds of things, not covered by Medicare. You'd have to get a separate plan. We call those standalone dental plans. And they're available. They're on average about $45 or $50 a month for a real good plan. All right. Okay, isn't everything a guaranteed issue when you first sign up for Medicare? And Jim, that is correct. But the issue is, the key to the guaranteed issue, Jim, is the B date of Medicare, because we'll have some people that will enroll into Medicare A. Let's say their birthday is, they're turning 65 this month, and they're still working or their spouse is still working. And if they're covered by a group plan that has 20 employees on the payroll or more, they don't have to do anything with Medicare. But they may decide to take Medicare A only. So I keep working, my spouse is. So I may have Medicare A effective 9/1 of 2024. And let's say I work 2 more years and I pick up B in 2 years. So I'd have an effective date on B of 9/1 of 2026. And so that's when my guaranteed issue period would begin. And so the point of and really the importance of the guaranteed issue is when we first are on Medicare B, we have a 6-month window prior to our B date and 6 months after our B date where we can enroll into any supplemental plan, of our choice, any company. and there's no medical underwriting required. But after 6 months of our B date, again, if my B date was 9/1/2024, I would have all the September, October, November, December, January, February. And so up to the last day of February, I could still enroll into a Medicare supplemental plan of my choice, no underwriting. But in my example, then March 1 on, if I ever wanted to get a supplemental plan in the future, the only way I could do that would be by going through medical underwriting. And that's it. Now, there are 5 states that don't require that. They have some other rules. That would be New York, Connecticut, Vermont, Maine, and Massachusetts. They have some additional rules beyond just that 6-month guaranteed issue. But it's very important. We don't want people to miss that, especially if they have health problems. Hey, I can tell you this real quickly. This just happened yesterday. By the way, in our company, we have about 100 employees, and I have a son-in-law who works here, 2 sons who work here, and one of my sons is an agent, and he told me about a situation yesterday where he had an appointment that was set up. And this is a gentleman that's going to start Medicare 11/1/2024. Appointment was set up. They'd called in. And between the time when we set the appointment and before my son had actually met with him, another agent talked with him, and told him and encouraged him to go with an Advantage plan, specifically an Advantage plan that was an HMO. And so my son noticed that this gentleman canceled his appointment, so called him up and just said, hey, is there, want to talk in the future? He said, no, I've already got a plan. And my son said, well, what did you enroll in? And he said, well, I took an Advantage HMO plan. And my son asked him, kind of why, and they kind of had the discussion. Listen to this. So when they're having this discussion, this guy was literally in a doctor's office, outpatient facility, and he was getting chemotherapy. Why? Because he had lymphoma. So someone had told him to enroll into an Advantage plan, and he has a lymphoma diagnosis. Okay, the only one who wins in that deal was the agent. Would get a nice commission effective 11/1, but that was the worst plan he could put someone in that has cancer. Why? Because if that gentleman misses his Medigap open enrollment period for years, especially with lymphoma, he's probably is going to have this cancer issue going on for a while. And put him in an Advantage plan. That was somebody who did not care about that guy whatsoever. So, and he had no understanding of this. And so my son told him the truth about his situation, and the guy said, no, I don't want an Advantage plan. I'm going to take a supplemental plan. And that was the right choice. As long as he could afford it, that definitely was his best option. All right? And so that's the point, is that's why this guaranteed issue is so critical. Had he stayed on that Advantage plan for over a year or more and wanted to get into a supplemental plan, he has to be cancer-free, treatment-free for at least 2 to 3 years. And that may never happen. All right, so that's the whole point of that. Let's keep going. All right, V, if you get Medicare Part B, can you opt out of it in the future, and is there a penalty? Yes, you can opt out, and the only reason, though, you would do that, and the only way you could do it, the right way would be if you go back to work or your spouse goes back to work, and you get an employer-provided plan that you're going to be covered by that has 20 employees or more on the payroll. So if it's a large group, 20 or more employees on the payroll, then you can drop your B and then disenroll from B. You can't disenroll from A once you've started it, and which is no big deal anyway, because most people don't have a premium. And then if you're going to work another year or two and covered by the group plan, then you can pick up B at a later date, and then you actually would start that guaranteed issue period over again, another 6 months of that second B date. All right, so you can do that. Now, I think there also could be, and I'm really sorry because I'm not really a great authority on this, but I think there could be a possibility you could drop B if you were going to move out of the country. And if you had some kind of other insurance outside of the country, that may also be a possibility. But don't quote me on that one. I'm not real up to date on some of those kinds of rules, but for sure you can if you're going to a group plan. The key to this is make sure that you stay covered by an active employer plan, and then you'll be qualified to come in under a special enrollment period called an SEP. All right, does Medicare Part A cost me per month? No, sir. As long as you have paid or your spouse has paid in 10 years into the Medicare tax system, Tom, and you probably have paid in 30 or 40 years, but anyone who has paid in for 40 quarters, because remember we get 4 quarters a year, so 10 years paid into the Medicare tax system, then there's never a premium for life. It's 0 premium for life, so no cost. People who have less than 40 quarters, when they come into A, they have to actually buy it. Can I apply for Social Security and Medicare at the same time and have different start dates for each? Absolutely, yeah. And the reason for that, Renee, is if you apply for both those same time. And by the way, if you work with us, we can do all that for you. You actually will specify your start dates when you're doing your Medicare B on an SEP. You'll specify your start date on your Form 40B. The L564 is what your employer is going to fill out to verify you've had credible coverage and you qualify for an SEP. That's called the L564. The 40B, that form, in the comment section, you tell them when you want to start it. So you get to pick your start date. Now, when it comes to the Medicare part of this, I would tell you, don't do any of this until about 90 days before you're going to need the coverage. If you do it 4, 5, 6 months in advance, they're not going to process it. So again, do it about 90 days before. Now, when it comes to Social Security, when you're going through that part of the application, they will actually ask you, when do you want to start your benefits? And so here's what you have to do. Let's say you want your first check in February, then you would tell them, I'm going to start my benefits in January, because Social Security benefits are always paid 1 month in arrears. So just remember that, but you get to pick those dates on the applications. Okay. All right, how to protect. Judy, the system is already designed to protect you, because once a supplemental plan has been issued, it is guaranteed renewable for life as long as you pay the premium. That's all you have to do. Supplemental plans can never be canceled by the insurance company except for non-payment of premium. So you miss a premium payment and you go beyond your 30 days of grace, they'll cancel the policy. But other than that, they can never cancel it, regardless of your age, health conditions, location. In your question, if you were to move, you'll take that with you always. Wherever you move, you can take it. Now, I will tell you this, when you move, the insurance company does have the right to raise your rate or lower your rate depending upon what rates are in that area. And I've seen them go down, I've seen them go up. It's usually minimal either way, but it's a lifetime plan. That's one of the beauties of supplemental plan. It's truly a lifetime coverage, just like A and B is. Okay, I'm 65, still working. Do I have to sign up for Medicare, and will I be penalized? And the answer is no, as long as you are working for a company that has 20 employees on the payroll or more. That's a large group. So anyone that's still within a large group, large employer, 20 or more employees, doesn't have to do anything with A, and doesn't have to do anything with B. Either one. You don't have to do A or B. Now, if you're with an employer that has 19 employees or less, then you have to enroll into A and B, because your company plan moves to the second payer position. Medicare pays first, company pays second. But if I'm in a large group, 20 or more, Medicare is going to pay second, group plan pays first, and that's why they don't make you enroll into Medicare. Now, listen. What I would do if I'm covered or my spouse is covered by an employer plan, 20 or more employees, and I don't have an HSA, Health Savings Account, I would enroll in A only. Go ahead and enroll in A only. It's usually zero premium as long as you have 40 quarters, right? And then you can pick up B whenever you get ready to retire. Now, if you have an HSA and you want to continue to contribute to that HSA, I wouldn't do A or B, and I promise you, you won't be penalized, because the only people that are penalized by not taking A only at 65 are those that have to buy A. They have to pay a premium for A. And if they don't do it on time, they're penalized. But if A is zero premium, there's never a penalty for Medicare A. Okay? But take A only if you're going to keep working, as long as you don't have an HSA. HSAs are wonderful, folks. And if you take A, you can't contribute. But if you don't take A, you just keep contributing and max out if you can afford to financially. All right, next one. Okay, where do I enroll? I'll be 65 in January. Well, if you're going to enroll into A and B and start your Medicare, then what I would do, I'd call the 800 number that's on the screen. This is our office, and we'll walk you through the whole process. We help people enroll into Medicare A and B, Social Security. They're going to start that at the same time, so we would be delighted to assist with that process. If you're just going to enroll in A only, what I would do, you can go to SSA.gov and set up an SSA.gov account. That's referred to as a My SSA.gov account. And once you have that account, and by the way, if you don't have one, it'll take you maybe 10 or 15 minutes to set it up. If I were you, I would use, I think it's the easiest one is Login ID. I'm pretty sure that's what they call it, loginid.gov. The other one is ID Me. But the point is, you'll set up an account and establish your login credentials. And then once you've done that, then you can log into that site and let them know I want to apply for Medicare. So you can do it right online. It's really quite simple to do that. But if you want our assistance, we'd be happy to help you. Just call the 800 number and set up an appointment to meet with one of our agents. And the answer is yes, they do cover ambulance. Does Medicare cover the cost of ambulance? I'm sorry? Oh, yeah, sorry about that. Okay, so William says, does Medicare cover the cost of ambulance trips? And the answer is yes, they do. That's on the B side of Medicare. That's going to be an outpatient. And so Medicare would cover that at 80/20, 80/20. They also cover air ambulance whenever that's necessary, okay? And so they'll pay 80%, you're responsible for 20%. Now, if you had a supplemental plan, either a G or an N plan, then it would cover that remaining 20% for you in full. But they will cover for sure. Okay, I've been out of work for over a year. I was on disability until August 31, 2024. I turned 65 in December. What if I cannot afford Medicare cost? Oh boy. Okay, well, what I would do if I were you, Timothy, if finances are challenging, what you want to apply for is what's called a Medicare Savings Program. Medicare Savings Program, and you also want to apply for extra help. And so the easiest way to apply for those would be through your state Medicaid office. That's the easiest way, state Medicaid. And then if not, then you can also talk to the Social Security office about that, and they would walk you through the process. And if you qualify, those programs are called Qualified Medicare Beneficiary and Low-Income Subsidies. They're great programs, and what they will do if you qualify, they actually will cover the cost of your Part B premium, and then your state Medicaid can participate in that as well. And then, Tim, what happens for you is if you do qualify for 100% state Medicaid, you are considered what we would call a dual eligible. Dual eligible means you're dual eligible, you're Medicare eligible as well as Medicaid eligible. And then there's some very nice, attractive Medicare Advantage plans, dual eligible plans. We call those dual SNP plans, and we write those all the time. So we'd be happy to walk you through that process. Okay, and so depending on your income, assets, you may be able to get some help. In fact, sometimes they'll pay everything for you. All right, Jose, I'm literally on no medications, turning 65 in February, and probably options for regular Medicare. Which Part D plans might be low cost for someone like me, or do Part C plans? Okay, well, Jose, if you are only looking at monthly costs, because again, you're healthy and I understand that, then what I would certainly do is enroll into Medicare A and B, and then if you want a C plan, then you can get a C plan that has integrated within it a prescription drug plan. We call those MAPDs, Medicare Advantage Prescription Drug. And so the only out-of-pocket you would be then would be for your Medicare Part B premium. And if you're single and you make below $103,000, or you're married and make below $206,000, your premium this year would be $174.70. That's $174.70 a month. Comes out of your Social Security check, or they'll bill you quarterly for that. So that would be kind of your lowest out-of-pocket monthly expense. And then I would just pick an Advantage plan or a C plan where your doctors are covered, your specialists, your hospitals, and your medications are covered well. And we write those plans, Jose, so we'd be delighted to kind of walk you through the entire process. Okay, and so that's what you can do. So that D plan is embedded within the C plan. I would tell you this, Jose. Last thing I would do would be get A and B only. I would not do that. You can have A and B with a D plan, but then what happens? You're responsible for all the gaps in A and B, and so that's the most risky option, to have A and B only. The next risky would be Advantage plans, and then the least risky, of course, would be supplemental. But if you don't want to spend any money on additional premiums, then just get that Advantage plan, which will have a low premium. And the good thing is, at least they cap your risk. They call that a max out of pocket. They set an annual max out of pocket, and so you pay copays till you hit the max. HMO is about $3,000 to $5,000, and PPO somewhere between about $4,000 to maybe $10,000. But at least you have a max established. If you had A and B only, there's no max. It just keeps going and going. And if you had a serious health issue, you would greatly regret that. All right. Okay, does Medicare pay for cataract surgery? Are there any limitations? And Medicare does pay for cataract surgery for sure. The only limitation is they're only going to cover a basic lens. If you want to get the upgraded lens, and whatever that upgrade fee is, that's what you'd have to pay for. But again, they'll cover the surgery, the basic lens, and they'll pay for new glasses or contacts after the surgery. But the upgraded, and I've had cataract surgery, and I'm not yet on Medicare, but I did do the upgrade for sure, and I think it was like maybe $2,500 or something like that to get the kind of the trifocal lens inserted. Well worth it, by the way, but Medicare will not cover that upgrade only. Otherwise, it's great coverage. Keep going. Okay, my primary care doc, urologist, and cardiologist each require office visits every 6 months, including blood work prior. Are these considered wellness visits? And the answer would be no, they would not be. But here's the thing. It looks like to me, if they're requiring it, it must be because it's medically necessary for you to come in for that visit and to have this medically necessary blood work. If it's coded as preventive, only one of those would be covered for the 12-month period. But if it's coded correctly, where it's diagnostic, medically necessary for the visit as well as the blood work, then that's going to be covered by Medicare. And by the way, your providers, they know how to bill this correctly. So I would call the billing department and say, okay, how is this going to work now that I'm on Medicare? And they'll walk you through the process. But it would be separate coding because we got preventive codes and we have diagnostic codes, and I believe all but one of these visits would fall under a diagnostic code. But check with them. They'll know because they want paid. They'll make sure of it. All right, do you go through underwriting if you move from a plan G to G with a different company? In most states, yes. If you're making that G to G move 6 months after your B date, then in most states you would have to go through underwriting. Now, the states that you don't have to do that, there's 16 of them. Some of those are called birthday states. Some of those are called annual enrollment states, and Missouri happens to be called anniversary rule. Okay, so what I'm saying is you move G to G in these states. I'll rattle them off for you real quickly. California, Oregon, Washington, Idaho, Nevada, Oklahoma, Missouri, Illinois, Kentucky, Maryland, New York, Connecticut, Maine, Massachusetts. I think that's 16 of them. Anyways, I don't know. But the point is, so of those 16, 5 of those East Coast states, New York, Connecticut, Vermont, Maine, Massachusetts, they have different open enrollment rules. Missouri's anniversary rule, and then the other states are birthday rule states. And so I can't get into all the details of all the birthday rule states other than to say if it's a birthday rule state, then what you can usually do is you can move from G to G or G to N. It's like to like or like to less. And most of the birthday rule states allow you to change carriers. Illinois and Louisiana, you have to stay with the same carrier, and that birthday rule right in Illinois is only good from 65 to age 75. So there are a few restrictions. But listen, if you call our office, we know all about that. We'd be happy to give you more information if you need that. Okay, but all the other states, so that would be 34 states, in order to move G to G after your 6 month of your B date, you would have to go through underwriting. All right, please share the IRMA charge. I was shocked to learn that Medicare would cost me $500 per month due to my prior income. It's a penalty that I was unaware of. Okay, well, Joe, I will share that. For those of you, okay, so it says, please share information regarding the IRMA. The IRMA is an acronym, and it stands for Income-Related Monthly Adjustment Amount. It's a surcharge. It's a tax. And, of course, he says, I was shocked to learn about it, and it cost me $500 per month. Okay, so here's the way it works, folks. Once you decide that you are going to be enrolled in Medicare A and B, then Medicare, let's say we're going to start this year, 2024, then Medicare notifies the IRS that you're starting Medicare, and our Part B premiums and our Part D drug premiums are going to be based upon our modified adjusted gross income. Modified adjusted gross, on your tax return, it's line 11 plus line 2A. So those two become our modified adjusted gross, and that number determines how much we pay for our Medicare B as well as our drug plan. And so what Medicare does is they establish thresholds. We have a single filer threshold and a married filing a joint return threshold. We also have one that's married filing a separate return. I haven't memorized those numbers. It happens so rarely. So married, filing joint, the threshold is $206,000 or less. You don't have an IRMA. If you're a single filer, 103,000 or less, you don't have an IRMA. But if I'm above 103 or above 206, then I have an additional surcharge, and those vary. There's actually 5 levels of IRMAs. The lowest level IRMA this year is about $82, and what Joe's dealing with here, it's over $500 a month. And so if I'm on Medicare in 2024, they're looking at 2022. Now, keep this in mind. If I have a life-changing event in 2023 or 2024, I can tell the government, don't look back at 2022. I've had a life-changing event: death, divorce, work stoppage, work reduction. There's 8 different events that if we have one of those 8 events, then we can appeal and ask the government to reconsider our IRMA charge because of this life-changing event that has affected our income and has brought it down. And so when we appeal, we fill out paperwork called an SS-44, and you work with us, we'll do all this with you and for you, but we can appeal saying, hey, I had this life-changing event, stop looking at 2022, I retired in 2023, or I'm retiring in 2024, and they will reevaluate that based upon new modified adjusted gross income, okay? And again, that's what he's talking about. And Joe, hey, listen, I hate that you have to pay it, but I always remind people this is a good problem to have. It really is, because it means you're, very, very high income. I'm sorry you have to pay extra. You're in that kind of income bracket. You're accustomed to paying high taxes, and they're just getting you another tax because of that income. That's the way it works. Okay, but appeal if you can. And by the way, Joe, even if you can't go all the way down, if you can just move 1 or 2 levels down on the IRMA, then I would take the time to appeal it. All right, KK, supplemental plan in, cover overseas medical cost if needed. Yes, but only up to $50,000. There are 6 of the 10 plans, C, F, G. N's one of them. Yeah, C, F, G, and I think it's M and N. Whatever. 6 of the 10. I'm blanking on all of them, but N is one. And when a Medicare supplemental plan covers overseas, it's foreign travel emergency. It's not that you decided to go overseas and get an operation. No, it's foreign travel emergency. So of the 6 of the 10 supplemental plans that cover foreign travel emergency, they attach a $50,000 lifetime benefit to your supplemental policy. And if you're overseas, you're outside the 50 states or outside the U.S. territories, and you have an issue that's emergency, then what happens is that claim money, the way they do it is you have to pay a $250 deductible, and then they'll take the balance of the bill. Insurance company pays 80%, you pay 20%, because Medicare pays nothing. You pay 20, they pay 80, but their 80% stops once they have spent $50,000. Okay, and that's why I tell people if you travel a lot, I definitely would get travel health insurance. Definitely if you have an Advantage plan, get travel health insurance because they hardly pay anything except for emergency room. So get that, and then always get an air evacuation rider. And use the good ones are about $1 million. They'll add to it. So if you had to be transported out of that country, to get back to the U.S. or somewhere else, that air evacuation rider, if it's a good policy, will cover the expense of that. And I've seen that happen before. So you want to be sure to get that. So the answer is yes. N does it, G does it, F does it, C does it, and a couple of other letters. All right. If your wife was a homemaker raising a family, did not pay any assistance for 10 years, do they have to pay for Part A plan? The answer is no, they don't, but here's the rules. So for your wife to be able to draw benefits off of your work record, it's fine to do so. There's a couple rules. Number one, you have to be married for at least a year. You have to be at least 62 for her to draw benefits off of you, meaning you have to be eligible for Social Security. You don't have to be taking, but you got to be eligible. Marriage had to last for a year. There's one other thing. Okay, marriage lasts a year, 62. And then, of course, she has to be approaching 65. Then she can get her 40 quarters from you. Just for information for those of you out there, we can do the same thing on an ex-spouse as long as the marriage lasted 10 years or longer. Then there was a divorce. We have to prove the marriage lasted 10 years or more through the divorce decree. And again, the spouse you're drawing from has to be at least 62. And here's the real kicker. You could not have remarried prior to the age of 60, because if we remarry prior to 60, you cannot go back to that previous spouse unless that second marriage ends in death or divorce. But if you're still married to that person, you can't go back to the ex-spouse. Now, if someone remarries after 60, then they can go back to that previous spouse. Has to last 10 years, and they have to be at least 62. All right, hope that helps. Let's keep going. Okay, does employer coverage have to credible for the medical and the drug part in order to delay B or just the drug part? And will manual employer notice? Okay, here we go. All right, so I know what you're talking about because of the new rules for Medicare Part D plans capping at $2,000. There's now concern that employer plans will or will not be creditable. So Jennifer, here's the way it's going to work this year. The government is giving the insurance companies basically an extra year to kind of line up to determine whether those are going to be credible coverage plans or not. They actually have two forms of test. They're letting these employer group plans use the old test, which means almost every plan is going to be credible for 2025. I didn't say every plan is going to be, I said almost. And so the insurance company will notify you if your drug plan is credible for 2025, and more than likely it will be. And then in 2026, which is giving them a year to kind of make all these adjustments, then we're going to find out. And so the medical is going to be credible. The question will be, will the drug part? So let's suppose, here's the way I see it. Let's suppose that the drug part is not credible for 2026. Then the only thing you'd have to do is enroll in Part A and then get a drug plan, because you don't have to have A and B to have a drug plan. You have to have A or B or both. And so in these situations where drug plan is not going to be credible, you can keep your medical coverage, because I know it is credible, enroll in A only, get a drug plan, and everything will be fine. And I think that's probably going to happen some in 2026, but I think the plans are going to adjust to this, and we'll kind of see what happens. But I wouldn't fret it now unless you get that letter from your employer insurance company saying, we are not credible. Then if that's the case, if you've got a good group plan at work, just enroll in A only and pick up a standalone Part D plan for 2025. Okay, I retired from the government, have insurance from them. I now work for a private company. I don't get insurance through. How do I explain that when I sign up for Medicare? Okay. All right, so your situation is interesting. I now work for a private company, but you don't get insurance through them. Okay, well, because you did not opt, one of the issues with you, I don't know how old you are, okay? So let's assume you're going to approach 65. You are going to need to, in my opinion, I would go ahead and enroll in Medicare A and B. Now, I'm also assuming that you're talking about government, meaning the federal government, and you qualify for FEHB, Federal Employee Health Benefits. You probably have GEHA or you have Fed Blue. And what I would do is I would enroll in A and B, and then let Fed Blue or GEHA, whoever you have, serve as secondary payer to your Medicare. And if you choose to not do what I just suggested, what's going to happen is this. You can get by with A only with your federal plan. What will happen, Medicare A will pay first, your government plan will pay second. But on the outpatient side, the doctor services of your situation, then your federal plan is going to pay first, you pay second, just like you've been doing. Okay, the issue will be if you do not enroll into Medicare during your initial enrollment period, which is 7 months, which 3 months before you turn 65, the month you turn 65, 3 months after. So if you forego enrolling into IEP and you want to pick up your Medicare at a later date, you do not qualify for a special enrollment period because you're not covered by a group plan on your other employment. So you can get into Medicare at a later date, but you're going to use the GEP enrollment called General Enrollment Period. And that's only the first 3 months of the year. And for every 12 months you go without Medicare B and have to use the GEP, you're going to be assessed a 10% penalty. And so if I were you, I would take your A and B now, use your government as secondary. It would be good insurance. Now, if you're paying $300 or $350 a month for that plan just for per person, then that's not good coverage anymore. And there's a lot of people today that have federal benefits that are coming off those plans. You can terminate it. You can fill out a form that you no longer have to pay for your Fed Blue or your federal plan. And that money right now is coming out of your annuity. So you fill out a form, they'll drop the premium, and then you can just get a traditional supplemental plan or a traditional Medicare Advantage plan. There's lots of people doing that today because those federal plans, some of them are not as attractive as they used to be. All right, I know that was a mouthful, but that's a little complicated. Let's keep going. Sorry about that. Okay, just signed up for Medicare in California. I'll be living in Arizona for 6 months, then return to California. Do I need to notify United Healthcare? I probably wouldn't if I were you. I think as long as if it's 6 months, the rules are this: wherever you are 6 months and 1 day, that is really where we would consider your official residence. So, if you've got a residence in, but you're saying it's for 6 months only. So if you don't have a residence there, then I would just keep it as is. All your rates and everything would have been based upon California. We'll have people that on this situation that have residence in both states. And then what we do, as long as it truly is right at that 6 months, then we would declare the one that has the lowest rates, and I would make that my home. Now, again, you have to be receiving mail there and all that kind of stuff. So if it's just a matter of travel, that you're not going to be in Arizona on a regular basis other than this first 6 months, I would not worry about it at all, especially if you have a supplemental plan, because they're not going to care. And so if you have a United Healthcare Advantage plan, I don't think they're going to care either, because they have that passport privilege where you can go outside of your network. And here's the thing, if you want to be playing on the safe side, if you do have an Advantage plan, call them, let them know. If you have a supplemental plan, it's a non-issue, because with supplemental plans, that's federal coverage. You have A and B in a sup, then that's the same no matter where you are in the country, so it doesn't mean anything at all. All right, I'll be 65 in April, not working. My husband has insurance through his work. Do I just apply for A only? Sherry, as long as the group has 20 employees or more, you can apply for A only. And especially if you don't have an HSA, I definitely would apply for A only. But again, it's the group size that matters. And as long as he's working, you're fine. You don't have to take B. But I also would say this, Sherry, if it were me and I was helping you, I would want you to find out what it cost your husband to cover you on his plan. And the way you do that is we would want to know employee-only price and employee plus spouse price or employee plus family price. We've had this happen many times. Sometimes employee-only price is $100 a month. Add the spouse, it's $500 a month or $600 a month. So all of a sudden, your husband's paying $400 or $500 a month for you. That's way, way, way too high. But if it's minimal, and he's only paying maybe $100, $150 a month for you, then just do A only. But take a look at that just to make sure you know that sometimes going into Medicare for one of the spouses makes sense financially. Okay. Kaiser Senior Advantage telling me I have a hospice coverage, not through them, but through original Medicare. I thought it could not go back to, well, here's what's going on here, Howie. When it comes to hospice care, all hospice benefits do revert back to original Medicare, even if you're on an Advantage plan. When the Advantage plan started, they basically started in 1999 and really kind of got geared up in 2003. That was one of the original agreements that when someone would go on hospice, that the hospice benefit portion reverts back to original Medicare, so that the Medicare Advantage plans don't have to pay for that. Now, here's the way it works. If let's say that you're a diabetic and you're getting your insulin through your Medicare Advantage plan, then they would probably continue to cover that. But for your pain medications and those things that you have that are just hospice related, then original Medicare would pay for that. So it gets a little bit tricky with some things your Advantage plan would still cover, but all the hospice, again, original Medicare A is responsible for that. So it's true, whoever told you that. My father's Medicare Advantage and Medicaid now, but he wants to go back to traditional Medicare. What company should I sign him up with? Well, I tell you, PK, would you call our office, please? This is really kind of an educational event when I do these, and so I can't really get into specifics of what company, but we're brokers, and we would be happy. So you see the 800 number right there, just call it. We're open 7 to 7 Central Time, so our switchboards are open right now. You can call in, and they'll walk you through that process. Okay, for sure. So we can do that. So just call in, please. I'd love to answer your question, but again, I need to kind of keep this kind of neutral when it comes to insurance companies. All righty, Thomas Fong. I'm a client of your company. How often do I have to renew or review the plan when I join your company? Okay, here's what happens, Thomas. In fact, I just actually shot the videos today. You are going to get emails from us, snail mail from us as well, and a video where we will explain to you the process of switching, depending upon what kind of plan you have. But we'll cover whether if you're on a SUP and you want to move to a different SUP, or a SUP you want to move to Advantage, or maybe you're happy with your SUP and all you want to do is change your drug plan. We have instructions about that. Sometimes people are on Advantage and they want to move to supplemental plans. So again, we'll provide instruction about how to make all those switches with our company, and we will facilitate that and will help you through that process. So those are forthcoming, sir. You will hear from us for sure. Okay, which plan would cover dental and vision? Just came back into the chat. Okay, well, if you want the insurance, the built-in insurance to cover it, that would be a Medicare Advantage plan. Medicare Advantage plans have what they call additional benefits. Those are typically dental allowance, vision allowance, hearing aids, gym memberships, usually some over-the-counter benefits. So that's embedded within the Advantage plan. Now, if you get a supplemental plan, it's not going to be embedded. You actually would have to buy a separate plan for that. And those are wonderful. They're true plans. And so you can get those, but that would be an additional premium. Those are about, usually a dental plan's about $40 to $50 a month. It will cover about $3,000 to $5,000 a year in dental services, and then a vision add-on is about anywhere from about $10 to maybe $16 a month. Okay, so you have to buy those separately if you get a supplemental plan. They're embedded with the Advantage, though the Advantage benefit's not going to be near like it would be if you bought a plan. So it's not apples to apples, but there is some benefit for sure. Okay, so Glenwood, what plans will retired military veterans need at 65? A and B provides TRICARE for life, C or D needed. Okay, so Glenwood, first off, your option is to have A and B with TRICARE serving as secondary. It's not a supplemental plan. Those are those 10-letter plans, but it is secondary, and it, frankly, it pays very well, and it does include drug coverage. It's not a Part D plan, but it's creditable. So you don't have to have a separate Part D plan. So you'd have A and B, you'd have your TRICARE that would take care of you for everything else, and good coverage. Now, what a lot of TRICARE people are doing today is they are getting, of course, you have to enroll in A and B, and what TRICARE will do is they will coordinate the benefits with a Medicare Advantage PPO plan, and we call those MA only. There's no drug coverage as part of that. So what that means is TRICARE will coordinate with the Medicare Advantage PPO plan, and again, you would have probably nothing out of pocket. But the reason some TRICARE people are doing this, really two reasons. Number one is then you get all the perks that the Advantage plan would offer, which would be, again, gym membership, hearing aids, dental, vision, all those things are not offered through TRICARE. Plus what happens, because you're getting your meds through TRICARE insurance, that Advantage plan will normally then give you what they call a kickback or a Part B reduction. And we don't know what those are going to look like yet in 2025, but right now some of those are $100 to $150 a month. And so it's kind of like reducing your Part B premium by $100 to $150 every single month. Then you get all the perks. And the good thing is about that situation is if you decide to do that MA only plan and let TRICARE coordinate with the Advantage plan, that's just an annual decision. It's not lifetime. If you don't like that system, in a year during Medicare open enrollment, you can go back and just have A and B with your TRICARE. So you're fine with that, but you're also fine if you want to try an MA only plan. We write those all the time. They're called honor plans or patriot plans, and they're really pretty attractive. And I don't see any negative in them at all, especially since it's not a lifelong decision. It's just an annual decision that you have the right to switch if you want. Okay. You're on Plan G. Does the price go up every 6 months or every 12 months? Linda, most companies, you're going to see an increase every 12 months. However, there are some carriers, what happens, it is just an annual increase, but they split it up. And here's the way that works. The majority of states in the country are what we call attained age policies. Let me back up. When you get a MedSup plan, every state determines how those initial premiums are going to be established. We have community rating, we have issue age rating, and attained age rating. The majority of those are attained age rated. And that means that every year, at the anniversary of your policy, you're going to be a year older. You've attained another birthday. And so because of that, you will see an attained age increase to your MedSup policy. Okay, you're going to see that every year. And so what happens, the company will take that attained age increase, and then if you happen to see another increase in 3 months or 6 months, it's because they took a group increase. All plans, community, issue, and attained age, take group increases, but attained age will take them every birthday. It goes up slightly to kind of offset the group increases. Those of you that are in community-rated plans or issue-age plans, you're still going to see increase, but that would just be once a year as they raise up the whole group. Okay, attained age could be twice, so that'd be the only reason, but it really is really the same amount, just kind of half each time. That's the way I would describe that. Okay, let's keep going. Here we go. Is my plan B cost reevaluated annually? Yes, sir. Yep. In fact, all that's going on right now, because as we roll into 2025, it's your modified adjusted gross income for 2023 that will determine your Part B premium. Now, you can appeal that if you have a life-changing event. I talked about that earlier. But every year they're going to do that, and they're working on that right now. And so sometime during last part of November or December, so you're going to get a letter stating how much your new Part B premium will be for 2025. Again, it's going to be based upon your 2023 taxes. All right, PA lady, enjoy these live events. I really learn a lot from all these questions. Good. You are very welcome. It's my privilege to do it, and I really love doing it as well. So I've been in this business now 15 years, and it's a joy. It really, really is to help people. So thanks for the encouragement as well. All righty, I'm 68, collecting Social Security, gone back to work and still collect Social Security. Since I'm paying again for Social Security from my paycheck, will my Social Security benefit be adjusted up? Well, it could. It could. They will evaluate that because, but let me say this, your Social Security benefits are always based upon your top 35 years. So if you're making more money now, that would have been higher than what it would have been some of your other 35 years, then yes, that will benefit you. And frankly, Tim, I don't know if you have to initiate that. I don't think so. I think they automatically do that, but it wouldn't be a bad idea to call your local Social Security office and say, hey, I know I'm making higher amounts of money now, and that could replace some other 35 years, and ask them if, when they recalculate that. I would assume they're doing that every year automatically, but I'm not positive about that one. But I do know for sure your income, if it's higher, it will increase your Social Security benefit for sure. Okay, let's keep going. Sorry about that one. Okay, Dale says, how exactly does the household discount work on Medigap policies? Do both have to sign up with the same insurance company? Okay, no. You have two types of discounts, Dale. You have household discounts, which means that you're not single, living by yourself, and then you have multi-policy discounts. So household discounts, what we would have to ask you is, do you reside with a spouse or a significant other? Some companies that significant other or spouse has to be above 50. Some it just has to be an adult. Doesn't even have to be, it could be a child that's an adult. That would be a household discount. Those range anywhere from about 5 to 10%. Multi-policy is even additional 5 or 10%, and that means that both of you are with the same carrier. You're both with United Healthcare. You're both with Aetna. You're both with Cigna, whoever the carrier is. So household means you live with somebody else, and the reason for that is because they know claim-wise when people are single, the claims tend to be higher than if they're married with someone. So that's why they give you the discount. All right. Does Part G, ARP, United Healthcare SUP plan cover eye exams for someone with an eye disease, not routine? And yes, they do. In fact, here's the way it works. Anything that Medicare covers, your ARP supplemental plan is going to cover except for your B deductible. So as long as that medical service is medically necessary and eye exams for diseases are, Medicare B is going to pay 80%, and your G plan pays your 20% coinsurance. So once you've met that B deductible once a year, $240 this year, that's all covered for sure. And you need those 6-month eye exams. That's exactly right. So eye diseases, anyone that's a diabetic gets those. Now, just so you know, that particular situation there is different than disease. So let's say you're diabetic, you get them every 6 months. That would be covered under preventive of Medicare. So on that preventive portion, that's going to be covered by Medicare 100% anyways. And then you get 2 of those a year. But even if it wasn't, your supplemental plan will pick it up because Medicare is going to pay first. Okay, if I'm on my wife's plan for a company with over 20 employees, can I just take Plan A and Plan G supplement? Well, lightning strike, I wouldn't. Number one, you can't have a Plan G unless you're enrolled in A and B. The only thing you can get if you have A would be a drug plan. You have to have A and B to get a supplemental Plan G or an Advantage plan. But again, I don't think you need that. If there's 20 or more employees and it's costing your wife less than $200 or more less a month to cover you on that plan and you're happy with the plan And as long as you don't have an HSA, I would enroll in A only. Don't get a supplemental plan, don't get a drug plan. Just wait until she retires, or if that plan gets worse or is not as attractive, then you can go on Medicare at a later date. So as long as she has active employment, you don't have to do anything. Take A only and just wait. But if you're costing her $300 a month or more, then I would drop that and again get A and B and G if it were me. All right. How much does it cost to use your agent services? Oh, nothing at all. Victoria, any agent that you use, and hey, we hope you use us. We'd be thrilled to be your broker. But you never pay the agent. The insurance companies are obligated to pay the agent. So we get paid commissions. And so that's paid by the insurance company, never ever by you. In fact, I think we have 45,000 clients, and we've never billed one ever. Why? Because the insurance companies pay us. And keep this in mind as well. The price that you pay, that premium is set by the insurance company, not set by us. So if you went with direct with an insurance company and the premium's $140 a month, or you went with us, it's going to be $140 a month. The price is always the same. What's different is what is that agent, that brokerage company bringing to the table for you. And the good thing is about a broker, we write from multiple carriers, so we can shop those for you, stay on top of all that for you to make sure you're always with, really the best company and the best plan. All right, so no money whatsoever. You don't pay us a penny. Okay, Steve, I have Plan G and would like to get dental and eye insurance. Can your group help me choose a good plan? Yes, sir. Steve, call the 800 number and tell the receptionist team that you want to talk about a dental plan. They'll transfer you to an agent that can talk to you about that. Sir, we'd be happy to help. Pardon me? Okay, I'm 72, thinking about dropping my work insurance, start Medicare B. My birthday is in December. Is there any advantage to switch to Medicare before 2025? I know I'll be saving money. Well, I don't think so. I mean, if it were me, most work plans are annual. So what I would do is, as you approach your your open enrollment season at work, let them know that you're going to drop the plan and you're going to go on Medicare effective January 1. Yeah, there's no benefit at all. In fact, especially if you've met your deductible on your group plan, I wouldn't do it that way. I would go ahead and start a new plan January 1. Now, let me tell you, Gwen, what's going to happen. And let us help you with this. We'd be delighted to, and we'll walk you through this. Very few agents know you know how to do this. But what we would do, you call in, and our agent will talk to you about the necessary paperwork, which is the L564 and the 40B. We'll fill all that out for you. The L564 goes to your employer. The 40B you'll have in your possession. With those two papers, you'll get those to your local Social Security office, and that'll bring you into Medicare B. Now, I'm assuming you have A. In fact, I know you have A because you're 72. That means you're taking Social Security, and you do have A only. So it's very easy to bring you into Medicare B, and we can walk you through that process. And so then I would start my effective date. I would request for my B would be 1/1/2025. I'd start my supplemental plan as well as my drug plan. So let your employer know here in the next few weeks or month, whatever. Let them know that you're going on Medicare then. And they have to let you go on, by the way, and they're delighted to. Call us, please. Let us help you through that. We'll make it seamless, painless, and mistake-free, guarantee you. Okay, how much is the G plan? Well, all depends on where you live, sir. It really does. I would say low side, probably without household discounts, multi-policy discounts, $130, $140 a month. High side, well, and there's a couple states, could be pushing $200. Again, it varies. And those states where it's a little bit higher, a lot of people are going with N plans. And by the way, N plans are good anyways. I'd go with a G or an N. The G plan fills 5 of the 6 gaps. The N plan fills 4 of the 6 gaps. And then the N plan has a couple of real small, reasonable copays. Difference in premium between the G and the N in most states about $40, but some it's even more. So again, call in, and depending on where you are, we'll tell you exactly where the rates are. We'll talk about the carriers and then the rate stability of those companies. But again, G or N. I will tell you, I'm 63. I'll be 64 in January, 65 next January. So if I were choosing today, I still would do a G plan because the $40 a month, the difference is not going to make or break me at all. But I'm not minimizing $40, by the way. If it was on the ground, I'd pick it up. But I like the fact that I can have something that's almost full coverage, and that's the G plan today. Most comprehensive, it's predictable. I know my premium. I know once a year I got to meet my B deductible, and then I'm done. I like that. Those that have N plans, I think that's still a very, very smart choice. They're going to save about $40 a month or more maybe. and they're going to take on just a couple small items. They're going to take on excess charges if and when they occur, pretty rare, less than 5% of the time. And then they have co-pays to go to the doctor of $20, emergency room $50. So again, that $40 difference, if someone says, hey, I'm going to save that, then I would go for the in plan. Either one of those would be excellent options. Okay, what are the differences in coverage between a supplemental plan and TRICARE for Life? Okay, well, yeah, your TRICARE for Life, I don't think has any premium. Right now, if you have TRICARE, you may have a premium, but TRICARE for Life is definitely zero premium. And so if I were you, Cruisin', you do not need a supplemental plan at all. I wouldn't want you to do that. I would have A and B with your TRICARE, which includes drug coverage. TRICARE pays second to Medicare, or I would enroll in A and B and then get an Advantage plan, because then you still get your meds through TRICARE, but you have a PPO Advantage plan, and with that comes some nice little perks that people like: gym membership, hearing aids, dental vision allowance, those kind of things, and that Medicare Advantage only plan, because you're getting your meds through TRICARE, they will give you some kind of a reduction on your Part B, which brings the cost of that Part B down. And if you're on Social Security, it means it increases your Social Security check. So I would look at that. We write those. Those are called MA only plans. So it's just another option. I'd look at it if I were you, just to see. And if you don't like it, next year you can change it. Okay. Okay, Jennifer, can you also just do the L56 440B online when you sign up for Part B, so you don't have to go to your local office? Oh, yeah. Now, your L564 has got to be completed by your employer, but yeah, you don't have to go to a local office. You can mail those in and fax those in. Now, what I would do, if you fax it in, I'll also mail a copy in, just because we've had times we faxed in and they said they didn't get it. So we always follow up with a hard copy through the mail. And then when you do that, always put a note on there, hey, I faxed this in, September 15th, just so they know you have sent it in and you're just doing this to make sure they got it. Okay? But you got to get it to the local office, because that's who's going to process it. Okay? All righty, Nanner, what does it mean in Wisconsin when our plans are mostly by age, but the expensive ones don't go by age? Okay, well, interesting. Okay, well, we write in Wisconsin. Wisconsin is like Minnesota and Massachusetts. You all have your own rules. And so by age, I've just never heard that terminology before. I think they're talking about attained age. So what does it mean in Wisconsin when our plans are mostly by age, but the expensive ones don't go? Okay. When you say a plan that doesn't go by age, that means it's community rated. And that means that everybody in that area, regardless of age, regardless of gender, gets the same price. Those are the ones that are higher. Honestly, I did not know that Wisconsin had community rated plans. By age means the 65-year-old pays less than the 67-year-old or the 69-year-old or whatever. And so we do write, Nanner, in Wisconsin. So why don't you call in and tell the reception team that you would like to talk to an agent, and they'll actually pull that up and they can go through those different options with you. Be happy to do it. Again, we write in Wisconsin all the time. All right? Yeah, you are like called a waiver state. They do things that are different. Excuse me. All right. Are you all out of questions? Okay, here we go. Rick, I turned 65 in October. Just signed up for A and B. Is it okay to keep my retiree medical plan until a January 1 because my wife is on it and she doesn't turn 65 until March? Any problem with that? No, it's not. Now, let's go back to the question for just a second, please, Daniel. I just want to keep reading that. Oh, okay. Wait until January to start my plan G. Okay. And Rick, it's not a problem. I wouldn't want you, so we got a B date of October. So we got October, November, December. So you're fine. You're fine to start your G plan on January. That's a good idea. You can actually put it off. She didn't turn to March. So let's do it this way, Rick. You have A and B of an October 1 start date. So we have all of October, November, December, January, February. You actually, if you want to, you can put that off. And what I would do is have both of you start your supplemental plans March 1, and you're still within that 6-month window of your Medigap OEP. Let's count it again. October, November, December, January, February, March. So you actually, I wouldn't. I'd submit in February for. I'd start mine when she's ready in March. But you actually even have an extra month because you have a 6-month window. So again, October, November, December, January, February, March. So you're good to go. I would keep that retiree medical plan for you and start your meds up 3/1. And I'd have her start 3/1 as well. That to me would make sense. And you still don't have to go through underwriting. Okay, if you want to start January 1, that's fine. But you could push it out as well if you'd like. You're paying for it anyways. All right, folks. Well, I think that's it for tonight. Hey, I want to thank you for joining in. Please do me a favor. If you're still listening, tell your friends about our program, our website, our YouTube channel. We love for people to go on and get an education and learn all they can. And then we'll do this now. Next Thursday, I'm out of town, but the following Thursday, every Thursday for the next several weeks, we're going to do these every Thursday. So love to have you join in, and helps you learn, but then also be a great resource for your friends and family member. And then if you need a broker, please, we'd love to have the opportunity to serve you, and we'll take care of you. We'll be honest with you and thorough with you, and it'd be our delight to work with you. So give us a call if we can help you. We'll see you next time. Thanks so much.